Sciatica leg pain can be debilitating, whether it's from a disc bulge, piriformis syndrome, or lumbar stenosis. If you've ever felt that sharp shooting pain down your leg, you know how it can stop you in your tracks. But what if I told you that relief is just a few easy stretches away? In this video, you'll discover what sciatica really is, explained in simple terms, along with the causes behind it. Most importantly, I'll share the 4 best stretches that have been proven effective with my patients over 30 years of clinical experience. These exercises are not only safe, but can also offer quick relief from that nagging sciatica leg pain. And as a special bonus, I'll introduce you to a revolutionary treatment that targets the root cause of sciatica at the spine, promising lasting relief when combined with these stretches. Keep watching so you don't miss out. Let's get you moving pain-free again. Hi, I'm Dr. John Zawonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. So what is sciatica? Sciatica is a debilitating condition characterized by severe pain that radiates down the back of the leg along the path of the sciatic nerve. This nerve is the longest in the body. It runs from the lower back, through the buttocks, down each leg. Sciatica symptoms can include sharp pain, numbness, tingling, muscle weakness all throughout the leg. The pain can range from mild to severe and is often described as burning or a shooting sensation. Now, there are 3 main causes of sciatica. Sciatica can be caused by several underlying conditions, but really 3 primary causes. Number 1, disc herniation or disc bulge at the L4-5 or L5 S1 level, by piriformis syndrome, and something called neuroforaminal stenosis due to spinal degeneration. So let's get into each of those. So disc herniation or disc bulge at L4-5-S1. So if you recall from previous videos, the bottom 5 vertebrae that are still not fused are what are called your lumbar vertebrae. Below that are the sacrum and the coccyx, and they are actually fused. So they're numbered number 1 through 5. And so when we talk about L4, 5, and L5-S1, that's the disc herniation happening between L4 and L5 or between L5 and S1. So a disc bulge or a disc herniation occurs when the inside part of the disc here actually starts to bulge out. It protrudes. So if you can see this here, this is a disc bulge where the bulge is now actually starting to come out. This herniation can compress nerve roots. It leads to symptoms of sciatica such as pain and tingling and numbness, weakness in the legs. Disc herniations are common in the lumbar spine, causing both back pain and leg pain. Number 2 on that list is something referred to as piriformis syndrome. So piriformis syndrome, your piriformis muscle is a muscle that actually runs from the sacrum, from the lower part of the back in here, and actually comes and attaches to the top of the femur. So when people talk about their hips, they always think the hips are here. They put their hands on their hips. Your hip joint is actually down here, and that piriformis muscle comes straight across there. It's what we call a rotator of the hip. So when it contracts, it will actually rotate the hip. And what happens is when that piriformis muscle becomes dysfunctional or becomes too tight, is that sciatic nerve goes right underneath that piriformis muscle. So if that piriformis muscle is contracted, it's virtually impossible not to be compressing the sciatic nerve. In about 80% of the population, give or take, that nerve runs right underneath that muscle. In about 20% of the population, that nerve actually runs right through that muscle. So again, if that muscle is contracted, again, it's impossible not to be compressing that nerve and adding to those sciatica issues. And then number 3 is that big fancy word we were using before, foraminal stenosis due to spinal degeneration. So spinal degeneration, if I call this spinal decay or spinal deterioration or advanced degenerative disc disease or osteoarthritis, all means the same thing. The neuroforamen That's the opening, okay, where this, see the yellow part here, that's the nerve. And the neuroforamen is the opening that the nerve actually comes through. So in stenosis just means narrowing. So what's happening is you have degeneration that then narrows that opening where the nerve comes out. So when we've done that to it, again, it's impossible not to be compressing that nerve. And again, that nerve is part of the nerve that then forms the sciatica nerve. And the narrowing is going to compress those nerve roots, and it's going to lead to symptoms of sciatica as well. Welcome to my home gym. Why are stretches useful for sciatica? Well, stretches, and here I'd like you to meet Kevin, my Dachshund. Stretches are an effective way to manage sciatica because they help relieve pressure on the sciatic nerve. They can improve flexibility, they can reduce muscle tension. For patients, this means less leg pain, improved mobility, and a better quality of life. Performing these stretches regularly can help alleviate leg pain and potentially prevent future flare-ups. Now, there are 4 sciatica relief stretches that we're going to go over. Before we dive into these stretches, remember, please just don't go through the motions. We've talked about this before. A stretch is something that you should actually feel a stretch. You should actually feel the muscle release. It's not just something where I count to 10 seconds and I'm done. We actually want to accomplish what we're trying to accomplish. So we want to target the area that's most commonly associated with sciatica pain. So number 1 is going to be a simple knee to chest exercise. So for a knee to chest exercise, you're just going to be lying on your back, and very simply, you're going to take one of your knees and you're actually going to bring it towards your chest. When we do that, we should be feeling a stretch. If you watch my left hand here, we should be feeling a stretch all through the glute back here. We actually want to hold that stretch minimum 10 seconds, could be 20, could even be 30 seconds, but we want to hold this long enough that we can actually feel the stretch ease up. And then we're going to switch to the other side. Okay? If you have a dog or a cat that can help you with the stretch, by all means do that as well. Okay? Same thing on the right side. Okay? Now we've got Yoshi entering the picture here as well. Okay? But I hope you can all see what we're doing here is we want to feel that stretch. And then we can even get to the point where we can do the double leg stretch. So now we're not just getting a stretch along the back of the glutes, but we're also getting that stretch even a little bit into the lower back as well, guys. Okay? So that's stretch number 1. Stretch number 2. What we want to do is we talked about how one of the biggest causes, or one of the causes of sciatica can be piriformis syndrome. And again, please be careful. Try not to single out one cause. People think they have one thing. They'll come in and say, I have piriformis syndrome, or I have this disc herniation. And in 33 years, it has never just been one thing. People typically have multiple things going on. But we know the piriformis can be one of those. So remember, that's the muscle that goes and attaches from the spine to the top of the femur, right at the hip joint itself. So we want to stretch that. So the way that we do that is this time, okay, we're going to take this right leg, we're going to bend it and fold it over the other leg, and then we're going to pull up like so. And when I do that, now I'm feeling a great stretch across here, right through the piriformis. And again, I'm going to hold that for a minimum, 10, 20, 30 seconds until I actually feel the stretch ease up. Now, when we do these stretches, same thing other side as well. And again, we're going to pull, and the more I pull, the more I'm going to feel a stretch through that piriformis. Okay, now remember to breathe during these exercises as well. A lot of times people forget to breathe. Stretching does not involve holding your breath. This is something that we want to continue to breathe while we're doing these things. Okay, stretch number 3, we want to do a simple hamstring stretch. So the hamstring is a muscle that runs along the back of the thigh, and from an anatomy point of view, your leg is actually the lower leg. Okay? The upper part of the leg is the thigh. So the hamstring attaches from the pelvis down to the back of the knee, essentially. And what we want to do for that is, again, something as simple as just bringing the leg up, and we should feel a stretch in the back of the hamstring. And again, we're going to want to hold this minimum 10, maybe 20, maybe even 30. But if I hold this long enough, I'll actually feel the stretch ease up. And when I feel it ease up, I can either go further or I can then switch to the other leg. So same thing, okay, is we want to feel that stretch in the back of the hamstring. By doing that, we're easing up the tension that's pulling on the pelvis. And if we can do that, that's going to change the function all around the hip joint and the lower back.
where that can actually give us some relief as far as sciatica goes. Okay? And then for stretch number 4, we can take the same hamstring stretch, but we're going to do what we call a nerve floss. So nerve flossing is, again, understand that nerve is going in the back of the leg. And so if we watch the foot, if I bring the toes towards me, I've now just increased that stretch, because what I'm doing, and then I go back again, and then I come towards me. So towards me like this is what we call dorsiflexion. When we go back like this, it's called plantar flexion. And what we want to do is we're literally stretching that nerve back and forth, right? And we're actually flossing the nerve. Right? For a lot of people, that can give them some very nice relief as far as sciatica can. But again, nice and slow, to the point where you feel a good stretch, not the point of pain. It is that old adage, no pain, no gain. Does not, never has, never will apply to stretching. We want to do that at least 5 times on each side, at least 10 seconds, preferably, again, even more, to the point where we actually feel that we've accomplished what we're trying to accomplish. So those are the 4 sciatica relief stretches that you're looking to do to give us some instant relief from sciatica. Beyond stretches, my clinic also offers a cutting-edge treatment called non-surgical robotic laser spinal decompression. This unique therapy combines spinal decompression and robotic class 4 laser technology. The decompression aspect gently decompresses the spine, reducing pressure on the discs and the nerves, while the class 4 laser helps reduce inflammation and heal tissue injuries. We have the only system in Ottawa, Ontario, and there are only 12 clinics worldwide that have these patented systems. Before starting this highly specialized form of care, we always conduct a comprehensive examination to confirm that each patient is a good candidate for this therapy. Non-surgical robotic laser spinal decompression is not only safe and gentle, but it also accelerates healing by addressing the root cause of sciatica. Backed by research, this treatment can provide both quick and permanent relief from sciatica leg pain when combined with the recommended stretching and exercise protocols. Now I want to hear from you. Please leave a comment below, share your experience with chronic sciatica. Let me know which of the 4 stretches was most effective for you. Was it number 2, the piriformis stretch? A lot of people love that stretch. Was it number 4, the nerve floss? That's also a great stretch for a lot of people. Tell me in the comments below. Also, share with us what treatments have helped you, and which ones haven't worked. Your story can provide valuable insight to others in similar situations. By sharing, we strengthen our community, offering support and understanding to those in need. If you're suffering from serious sciatica or serious low back pain, this is not just a small little backache, and often people don't understand that unless they've actually been there. And remember to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. The next video you should watch takes you through a step-by-step non-surgical treatment, very specific protocol for conditions like sciatica, disc bulges, and lumbar stenosis. Don't miss out. Watch it for more effective relief strategies.